some of my thoughts on laser light therapy for hair loss. It's also known as low-level light therapy. It's known as laser therapy. This is a therapy that many of you have probably heard of. You've probably seen it on the internet, and it's a therapy that's been shown to work. The results vary between different people. Some people get excellent responses and grow back a lot of hair. Some people just maintains the hair. The only way to really know is to try it yourself. Usually people who have thinning hair are the ones that respond, because that's what happens with hair loss. People begin to get their hair a little thinner, 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 and if you get it while it's thinner, there's a substrate for that laser to work on to bring it back. So the reason it works is they say that it's known to stimulate mitochondria and increase a number of mitochondria in cells, which increases mitochondria, which increases energy and oxygen production. I basically look at people with hair loss as needing help, and there's a couple things you can do. You can do surgery if they have enough donor, but even if you do surgery, almost everybody needs what I call adjunctive therapy that will help them maintain their hair, not lose more hair, or grow their hair back. There's a lot of different things that do that now. There's Rogaine, minoxidil, there's finasteride, there's regenerative therapies. There's a lot of things, but the ability to keep your hair or grow it back is important, because otherwise we know that hair loss is a progressive process, and over the years, if you're not using something, you will get worse. If you do a surgery, you'll look good for a while, but you will get worse. So part of any practice is very important to try to keep the hair they have or grow it back. If you grow it back, they may need less hair surgery. So, and this particular modality, the laser light therapy, is one that's very popular because, first of all, people don't like to take drugs. People don't like to take medications. This is safe. There's really no side effect to this. So it's something that people can do who are nervous about, medical therapy. And it's also pretty cost effective, because a laser hat will last years and years and years. So you have the initial cost, but it's something you can do for the rest of your life. You can share it with your family. So it's a pretty good cost-effective treatment for people. And like I said, it works in a lot of people. In my office, I like to use it for people who are just coming in and they're not ready for surgery, to grow back their hair so that or to make their hair stronger so that when we do surgery, there's less shock loss. Or when we do surgery, there's less, they need less grafts. I also use it a lot for people who are just beginning to lose their hair. They're not really a surgical candidate. Maybe it'll save them from surgery. And get sort of a diffuse hair loss. And they're not the best candidates for surgery until they get a lot of hair loss. And also, they have a tendency that if you do surgery, they may get shock loss. So this is a very good treatment for women. And women who are young can't take some of the major medications because of problems with potential side effects, like finasteride can't be given in women in the years of childbirth. So it's a great tool that people should know about. One of the ones that I like to use is the Hair Smart. And this company makes a laser that's medically grade lasers. They're not LEDs. Very easy to use. You just do 7 minutes, 7 times a week. It's very easy for the patient. The company itself is very good. The support, the care, the price as compared to others is better. So it's one of the ones I recommend out there.